Meet Dr. Al-Rashid. She treats women with breast cancer every single day. One of her patients, Sarah, a mom of two, has a very specific type of breast cancer. And for this type of cancer, Dr. Al-Rashid prescribes a powerful treatment that can save Sarah's life, but also affect her heart. So every time it's prescribed, Sarah needs to check her heart with a scan every 3 months. Now for Sarah, this means more hospital visits, more waiting, more anxiety, on top of everything else she's already going through. And for Dr. Al-Rashid, it means juggling those full imaging schedules and the limited healthcare resources she has, all while trying to provide the best possible care for Sarah. But Dr. Al-Rashid knows something very important, and it's that not all patients have the same risk for heart problems. In fact, new research suggests that some patients can safely have fewer heart scans if their heart risk is checked before the treatment begins. But before this becomes routine care, we have to ask a very important question. What helps or holds back doctors like Dr. Al-Rashid from changing how they monitor the heart during this cancer treatment? You see, guidelines alone don't become routine care. If we don't understand how healthcare professionals think through these decisions in their day-to-day practice, they may never adopt the guidelines we propose. So this means guidelines would only exist on paper and never reach patients like Sarah, who they're meant to help. So to make sure guidelines do become routine care, we first need to understand why healthcare professionals make the decisions they do. And that's where my research comes in. Along with another graduate student, we're interviewing doctors, nurses, and physician assistants all across Canada who prescribe this life-saving cancer treatment. We're exploring how they check heart risk before treatment begins and how they decide whether to reduce the number of scans over time using this new approach. We then analyze the conversations we're having to understand why they make the decisions they do. And then using those insights, we can then develop a practical tool that supports what already helps them and reduces what holds them back from using this new approach. This way, when guidelines do change, they can start using it with more confidence. Now for our Dr. Al-Rashid, this means ordering less tests, but most importantly, more confidence in her decisions. And for Sarah, it means less hospital visits, less waiting, and less anxiety, but the same life-saving cancer treatment that's now delivered more thoughtfully, with confidence, compassion, and care that truly reflects her needs.